Today we are going to study the 5 nerves that are this axillary nerve, this is radial nerve, musculocutaneous nerve, median nerve and ulnar nerve and axillary nerve. This is the root value is C5 and C6 and it is a branch of posterior cord. It is going to the backside of the quadrangular space, accompanies the posterior circumflex humeral artery, and it given the two branches, that is posterior branch and anterior branch. Anterior branch winds around the surgical neck of humerus and it supplies the deltoid muscle, and the posterior branch is going to the teres minor to supply that muscle, and the posterior the motor innervations of this muscle, this nerve is the motor innervations are the deltoid muscle and the teres minor muscle, and the sensory innervation to the shoulder joint. And the applied anatomy of this is, if the injury in the surgical neck of the humerus, the sensory loss and deltoid muscle is going to paralyze. The disability of the person is he cannot abduct the hand to the 90 degree. This is the musculocutaneous nerve. It is a branch from the lateral cord of the brachial plexus, and its root values are C5, C6, C7, and it is running. This musculocutaneous nerve pierces the coracobrachialis muscle, and it supplies the three muscles of the front of the arm, that is brachialis, coracobrachialis and bicep brachii. In the lower half of the forearm, this musculocutaneous nerve is continuous as a lateral cutaneous nerve of forearm. This musculocutaneous nerve in the arm is purely motor, and while that of in the forearm is purely sensory. This is the radial nerve, and it is a branch of posterior cord of brachial plexus. Its root values are C5, C6, C7, C8 and T1. This nerve is going to the posterior to the lower triangular space and accompanies the profundus brachii artery, and it in the upper part it runs to the posterior, and in the forearm it runs in the anterior part, and it in the forearm it supplies the muscle, that is extensor muscle, that is tricep brachii. The radial nerve in the forearm gives the two branches before entering the cubital fossa, that is superficial branch of radial nerve and deep branch of radial nerve. Superficial branch of radial nerve runs in the cubital fossa, and deep branch of radial nerve, it is passing through the two heads of supinator muscles, and it is also called posterior interosseous nerve, which supplies all the muscles in the extensor compartment, and the superficial branch of radial nerve, it is running in the forearm. This is the superficial branch of radial nerve, and it is in the anatomical snuff box, and it is supplying the two and half of the phalanges in the dorsal part of the forehand. The clinical anatomy of the radial nerve. Clinical anatomy of the radial nerve is, one is wrist drop and another is Saturday night palsy. This is the ulnar nerve, which is a branch of medial cord of the brachial plexus, and its root value are C7, C8 and T1. It is in the ulnar nerve in the arm, it run in the anterior, and in the lower part is run in the posterior compartment. The ulnar nerve in the flexor compartment, it supplies only two muscles, and others are supplied by median nerve. The two muscles are supplied by the ulnar nerve. One is flexor carpi ulnaris and another is medial off of the flexor digitorum profundus. This is the ulnar nerve, passes superficial to the flexor retinaculum, and it supplies all the muscles except the thenar muscles and two lumbricoids, and in the phalanx it supplies only one end of the phalanx, and the three end are supplied by the median nerve, and it supplies the two end of the phalanges in the dorsal part of the hand. In the applied aspect of ulnar nerve, the applied aspect of the ulnar nerve is, if ulnar nerve was damaged and it caused the ulnar claw hand, which is the in the last two phalanges, the flexion at the proximal phalanx and extension at the metacarpophalanx joint. This is the median nerve. It is formed by the two nerves, that is one is from the lateral cord and one is from the medial cord. In the lateral cord, the lateral root of median nerve and in medial cord, medial root of median nerve, they are two joined to form the median nerve. These are the two branches. See, these are the 2 branches, and this is the median nerve. The median nerve root value is C5, C6, C7, C8, T1, and it run anteriorly in the throughout the arm and the forearm. It is passing through the cubital fossa, and it supplies all the muscles except medial half of in the forearm. It supplies all the muscles except flexor digitorum profundus and flexor carpi ulnaris. In the upper arm, it runs medial side of the brachial artery, and after the cubital fossa it crosses the brachial artery, and it runs lateral to in the forearm. And the median nerve, it passes in the carpal tunnel and below the flexor retinaculum, and it supplies the thenar muscles and the first 2 lumbricoids and 3.5 the phalanges as a cutaneous nerve. And the applied anatomy are, if the median nerve is damaged, it causes the ape thumb deformity. That is, if in the thenar muscles these are paralyzed. And another one is carpal tunnel syndrome. If the compression of the median nerve in the flexor retinaculum or carpal tunnel, it causes carpal tunnel syndrome.